When it comes to the safe dispensing of drugs, Ohio's pharmacists say the current system works and questions why lawmakers want to change it.
And the legislation will actually cause more regulations, less freedom, and more restrictions on pharmacists, doctors, and patients to implementing a policy that is legal and occurs today without encumbrance.
State Representative Jennifer Gross is the sponsor of House Bill 12, known as the Patient Right to Try Act.
The problem today is that if a physician does something off-label, our medical board can come and remove their license if they determine that it is not a risk worthy of taking.
House Bill 12 prohibits professional discipline, fines, or sanctions against a prescriber, pharmacist, or other licensed healthcare professional for expressing an opinion about a drug or other medical intervention that does not align with that of a health-related licensing board or other health authority.
Because it removes professional judgment away from the pharmacist and forces them to fill prescriptions that they may not have all the information they need to protect your safety.
Representative Gross says the bill is about protecting free speech of physicians.
When we stifle the physician from being able to speak about what they believe is good for you and what is not, then we have decreased the ability for a physician to actually give informed consent.
Governor Mike DeWine vetoed an earlier version of the bill, saying Ohio's medical licensing boards exist to protect patients and the public from bad actors in the medical field. Health professionals who give harmful medical care shouldn't get a, quote, legal shield to avoid accountability by saying there was a difference of medical opinion.
This bill actually still retains the ability for a patient to sue, and gross negligence is covered in here.
The Ohio Pharmacists Association believes the bill will harm patients, not help them, and opens the door to another danger.
And it opens the door to doctors who are out of state to open up pill mill type businesses that basically crank out prescriptions for cash that are off label that the pharmacist has to now fill without question.
The bill does exclude controlled substances. Critics of the bill use the example of the malaria drug hydroxychloroquine. The Trump administration and others promoted it as a treatment during COVID, and some states spent hundreds of thousands of dollars to stockpile it. It was later determined to be an unproven remedy. Kevin Landers, 10 TV News.